Here are the top 5 worst human parasitic infections. Number 5. Lymphatic filariasis or Elephantiasis. Infection is caused by filarial nematode worms transmitted through the bites of infected mosquitoes. Key symptoms include lymphedema, which is the progressive swelling of the limbs, especially the legs, due to lymphatic system damage, Elephantiasis, which is thickening and hardening of the skin and underlying tissues leading to severe disfigurement, and Chyluria, which is urine that looks like milk. Number 4. Schistosomiasis. Infection is caused by trematode flatworms acquired when skin comes into contact with freshwater infested with the parasite. Key symptoms include dermatitis, which is an itchy rash at the site of the entry of the parasite. Then we have the acute schistosomiasis, which includes fever and chills, coughing, abdominal pain, diarrhea, and eosinophilia, which is elevated eosinophil count, and the chronic infection, which infects the intestines with chronic diarrhea and abdominal pain, and the urinary tract system with hematuria and dysuria. Number 3. Leishmaniasis. Leishmaniasis is caused by protozoan parasites from the genus Leishmania that are transmitted through the bites of infected female sandflies. Key symptoms in cutaneous leishmaniasis include skin lesions, ulceration, and secondary infections due to open ulcers. In visceral leishmaniasis, key symptoms are prolonged fever, weight loss, hepatosplenomegaly, and pancytopenia. Number 2. African trypanosomiasis or sleeping sickness. It's caused by protozoan parasites from the species of Trypanosoma, which are transmitted to the bites of infected flies from the genus Tsetse. Key symptoms in early stage or hemolymphatic phase include painless ulcers at the site of the Tsetse fly bite, fever, lymphadenopathy, headaches, muscle aches, and generalized itching. At the late stage or the neurological phase, we have sleep disturbances where the sleep-wake cycle is reversal, neurological signs like confusion, personality changes, irritability, psychosis, motor deficits like tremors, seizures, coma, and even death without appropriate treatment. Number 1. Malaria. Malaria infection is caused by a Plasmodium species transmitted by female infected mosquitoes from the genus of Anopheles. In uncomplicated malaria, we have symptoms like fever, chills, headaches, GI symptoms like nausea, vomiting, diarrhea, anemia and jaundice from hemolysis of red blood cells, and splenomegaly, which is an enlarged spleen due to increased breakdown of red blood cells. In severe malaria, which is mostly associated with Plasmodium falciparum, we have cerebral malaria, which alters the mental status, severe anemia, hypoglycemia, acute respiratory distress syndrome, which is pulmonary edema leading to hypoxia, renal failure, metabolic acidosis, dark urine from massive hemolysis, bleeding and clotting abnormalities, and shock. It is also essential to recognize that these diseases not only cause physical harm, but can also have significant mental health impacts, as some of them can cause disfigurements, preventing individuals from living a healthy, normal, and stress-free life.